Good afternoon. I'm Liz Krueger. I'm the state senator who is sponsoring this afternoon town hall on telehealth basics. I'm very excited about this show. We've been doing lots of different town halls over several months, but this is the first time where we will have breakout rooms towards the end, and we'll be explaining those to you. All right. Before I get into today's proceedings, I want you to be aware that we have closed captioning. So as a viewer, you have to activate closed captioning to view the text on your device. And you can click on live transcript in the meeting controls to start viewing closed captioning. And because of the large turnout, and to make sure we keep things running smoothly, audio and video has been disabled for audience members. When the times come for question and answer session, you will be able to type your questions into the chat, and we will get to some of them, not all of them. We never get to all of them. But that's okay, because this is a format where after we finish Q&A, you will be able to get into a room that you've signed up for that explains telehealth at your chosen hospital. But we have to make sure the name associated with your screen is the name associated with you when you signed up. So now a voice is going to come on and tell you what to do if your screen name, instead of saying, say, Liz Krueger, says Liz's iPhone. So, Justin.
So depending on your device, it may be a little different, but in general, if you can find the box that has your name on it, put your mouse on it or your cursor and click the three little dots in the corner. You should have an option there that says rename. Click on that and you can type in your name there. Otherwise, you can also click on participants at the bottom of your Zoom screen. That will bring up a list of all the participants. Your name should be at the top. Click more and click rename. If you are unable to rename yourself, you can send a message in the chat with the hospital that you'd prefer to go in, and we will put you in that breakout room.
Great, thank you. So you have two options. Try it yourself, and if that's not going to work, send us a note and we'll figure it out. So I always start all of my town halls with some updating announcements, particularly in a time of COVID where the world changes almost every day and we want to know the most up-to-date information. So the good news is the Johnson & Johnson vaccine has become available. It's a single shot vaccine approved by the FDA for individuals over 18. I'm not saying whether it's better or worse than the others. The relevant part is now we have a third vaccine, and it does appear that the quantities of vaccine have been significantly increasing in our city, where everybody's been looking for these shots forever at this point. So don't give up on us. More vaccines are on the way. And because there's now 3 choices, we just have larger volume. According to the governor's office, the Javits Center here in Manhattan, the Yankee Stadium mass vaccine site, and pharmacies will be receiving shipments of the Johnson & Johnson vaccine, and available appointments at the Javits Center were posted yesterday. Although by last night, I noticed they were all used up, but I'm not sure for how many days, so keep trying. And remember, with the Johnson & Johnson, it's just one shot. So there's also likelihood that the city will be able to help figure out how to expand distribution, ensuring that people who are homebound or who know they can't get to a mass center and stand in line for 3 hours will be able to get it. And of course, there'll be more and more drugstores that will have the vaccine available. And there's nothing wrong with checking with your own drugstore and asking them if they have it and if they can help you with an appointment, particularly if you're one of those people who doesn't love figuring things out by computer, because sometimes it's hard. Or though this telehealth little workshop is designed to help you get better and better at using the new technologies. I will continue to provide vaccine updates and appointment scheduling resources in the emails that come out of my office regularly. If you do not receive these emails and wish to do so, or if you have questions about how to schedule a vaccine appointment, please contact my office. As you may already be aware, the New York City Health Department issued guidance advising New Yorkers to wear 2 masks, a disposable and a cloth mask, or a KN95 mask when outside of your home or when non-household members are in your home. It's very important to wear a mask that fits snugly and to wear it properly so that your mouth and nose are covered at the same time. You know, all the things they were telling us in the beginning are true. Wear the masks, keep 6 feet apart, and keep washing those hands. We're not out of the woods yet. There are concerns about the increasing presence of COVID-19 variants in the city and state, and the potential for community spread to increase as the variants are more contagious. And that's why we all need to make sure we're getting vaccinated and we're still playing it smart and safe. So this afternoon's event, I am pleased that you're able to join us for the Telehealth Basics Town Hall. The pandemic has necessitated that we visit our doctors virtually. And because of ease of use and to maximize scarce resources, telehealth is here to stay. So it's important that you learn how to use it. Today's event is in 2 parts, as I mentioned earlier. During the first part of the town hall, you're going to hear from Lorraine Wojtek, Director of the Connect Through Tech program at DeRote, which we worked with to develop and plan this event. So thank you so much, all of you at DeRote, but particularly Lorraine, who you'll hear from soon. And after Lorraine, we will have Dr. Sarah Czaja, Professor of Gerontology and Director of the Center on Aging and Behavioral Research at Weill, Cornell. Dr. Czaja will provide an overview of telehealth basics, share when to use telehealth, and how to maximize your experience. After the presentation, I will moderate a Q&A portion of the town hall. And for the final portion of the event today, from around 2:55 to 3:30, you will be placed in a virtual breakout room with the hospital that you indicated when you registered for today's event. In the breakout rooms, you will receive an overview of how to access telehealth visits online, because there are lots of different systems and no 2 systems are the same. So we're really delighted that all the hospitals in my district are participating today. And I want to thank the teams from each of them. I'll just mention each hospital. So when we have the breakout rooms, your choices will be Bellevue, the Hospital for Special Surgery, Lenox Hill Hospital, Memorial Sloan Kettering Hospital, Mount Sinai, New York Presbyterian, NYU Langone, and Weill Cornell Medicine. Okay, they have all been great to work with. They're creative and they're figuring out the best way to make telehealth work for all of us. It's a new concept, a relatively new concept. And so you'll learn that things are changing. I know I had an appointment with my own doctor this way, and first they had me go on for 20 minutes to make sure I would get it to all work correctly when I finally got her on screen with me. And I was really glad that I had had the introductory training, so to speak, before I got on with her, because it just would not have worked as well. So at approximately 2:50, those of you who chose the hospital when you RSVP'd will be automatically placed in the breakout room of your choice. If you did not choose a specific hospital, we have chosen one for you. And again, if your name doesn't match and you can't get it to, you're going to type that into chat and we're going to make sure we take care of that for you. And with that, it is now my pleasure to introduce Lorraine Wojtek. Hi, Lorraine.
Hi, Senator. Thank you so much for having us today. I'd like to take a few minutes to just extend my thanks not only to you, but for your incredible staff who helped put this event together today. And a special thank you to Dr. Czaja and to all of the wonderful healthcare partners that are here today to share their expertise on telemedicine with us. For those of you who do not know DeRote, we are a nonprofit based here in New York City. We provide social connection and resources to older New Yorkers. Every single day when I'm working, I am reminded of how incredibly resilient and adaptive older New Yorkers are as they're joining our one-on-one technology coaching program. They're coming to us to either expand their knowledge on how to use technology or just to even explore it for the first time. I think we've all discovered that technology has a means of making our world bigger, even if it's, as we've had to spend more time at home. And these are resources that will be available to us long after the pandemic has gone on and been taken care of. So these are really important options for us to be learning about right now. When we first talked about this with the Senator's office, we all agreed that looking beyond the pandemic and how this might benefit the constituents would be an important option. With the information that you'll get today, you'll really understand how to be able to use telemedicine so that you can visit with your regular doctor without the cost, the time, the exposure, or the exertion of travel to the office. If you're looking to learn about other aspects of technology, we would be happy to help you with that at DeRote. We will be putting into the chat our contact information so that you can connect with one of our one-on-one trained volunteer coaches who can help you at no cost. Thank you so much for having us today.
Great, thank you so much. And now we're going to turn to Dr. Sarah Czaja. And thank you so much for being with us, Doctor.
Okay. Everyone see my screen?
Yes.
Okay. Good afternoon, everyone. It's a pleasure for me to be here. I'm very honored, and I want to thank Senator Krueger for including me, and also to my friend Lorraine and the staff who helped organize, and of course DeRote, which I think is a really terrific organization. So I'm going to talk a little bit about the basics of telehealth, and I will be throwing in a few bits of our research, and I just would like to acknowledge the National Institutes of Health who funds all of our programs. I don't know what those lines are. Huh. Someone's drawing on my screen.
I'm not sure.
Oh, brother. Okay, anyways, I'd like to start by describing our Center on Aging and Behavioral Research, provide an overview of some of the recent healthcare trends, which really speaks to why telehealth is such a huge topic right now. Discuss some of the benefits, and there are associated challenges with telehealth, and then provide some basic tips on telehealth visits. So if we think about, I just want to talk a little bit about our center so you'll know where I'm coming from and where I sit. I'm in the Department of Medicine, specifically in the Division of Geriatrics and Palliative Medicine that has 3 arms, a clinical, a research, and education arm. And you see that our center is part of the research component of the division. Within our center, we have 2 other centers. One is called CREATE. This is a multi-site center funded by the National Institutes of Aging that focuses on older adults and technology interactions. The second is called ENHANCE. This is focused on, sponsored by NIDLR, and the focus here is on developing technology supports for aging adults with a cognitive impairment. Here's our team. We have a very mixed team. We have behavioral scientists, statisticians, because we focus so much on technology, computer programmers, and of course our geriatric specialists. So what are we currently focusing on? We like to do applied research and focus on clinically and socially relevant issues for older adults. Specifically, we do a lot of work in family caregiving, promotion of physical well-being, a big push now in the whole area of social isolation, and then of course in telehealth applications. And I just want to say this to tell you where we are coming from in this center, what we think about in terms of population aging, which we're all familiar with. One is we associate population aging with a lot of opportunities. Okay? And I think this is something that's often overlooked when we talk about aging, is that the prevalence of older adults in the population brings a wealth of opportunities for us in terms of productive engagement, expertise and skills. A lot of older adults are engaged in caregiving and family support, and then of course maintaining and transferring culture and tradition. At the same time, there are some challenges associated with population aging. There's strain on some of our social support systems, on insurance and pension, living environments, transportation systems, and then of course our focus today, which is the strain on the healthcare system. The reason being that as one grows older, the prevalence of chronic conditions such as cardiovascular disease, cancer, diabetes, arthritis, and dementia increase with age. Here's some data that just show the percentage of people, this was at one snapshot in time, of people who do have a chronic condition. These are people over the age of 65, and many, as you know, have more than one chronic condition. And the treatment for people with chronic condition right now accounts for about 86% of the $3 trillion in annual medical expenditures in the United States. So it is a big concern. Okay? And currently, you know, these costs may increase, as right now about 50 million people worldwide are living with things like with Alzheimer's disease and dementia. And unless we find a cure, this is going to reach 75 million by 2030. So you can just see how the healthcare costs have increased. The USA is the dotted line on the top over the past couple of decades. And as I said, this is partly due to treating more chronic conditions, typical of an aging population. At the same time, we see some interesting healthcare trends. We're moving more towards a partnership model of care where patients and consumers are expected to take a much more active role in care management with their healthcare providers. We also see a lot of care now migrating away from clinics and being done in home settings, partly to take advantage, which we're going to focus on today, of developments in technology. There is a huge increase in the deployment of technology. Technology is really starting to be considered a partial solution for meeting the healthcare needs and diminishing some of the healthcare costs that we're currently facing. And individuals are increasingly relying on and using technology for the transfer of health information. You can see all kinds of healthcare technologies. Now, during the COVID-19, there are some special challenges that we are all very familiar with. One is the stay at home, of course, and pause requirements. And this drastically diminished older adults' opportunities for social, cognitive, and physical engagement, limited access to routine medical care, to social support networks, structural support, such as group meals or planned activities, limits the ability of both informal and formal caregivers to interact with their older adult care recipients, increased problems with social isolation and loneliness, and increased use of technology to provide access to care and support. For example, at the very beginning of the pandemic, Weill Cornell Medicine was engaged in about 2,000 virtual visits per day. And this number has increased since then. And I just found some interesting data that was published recently. I believe it was by the CDC. And this is just showing, if you look at that solid black line, the increase in telehealth visits, if we compare what happened in March 2020 as opposed to 2019. 2019 is the lighter blue or the violet shaded figure on the graph. And you can see that while the ED visits went down, the telehealth visits went up. And this is just one snapshot in time from 4 telehealth providers who offered services across the United States. So what is telehealth? Okay, there's a lot of definitions flying around about what telehealth is. And basically, it involves the use of electronic information and communication technologies such as computers, mobile devices like an iPad or an iPhone to access health services remotely, to access health information or educational materials, manage your own healthcare. As I said earlier, that's becoming increasingly important in today's healthcare scenarios, and also to help clinicians provide healthcare services. There are a wide variety of telehealth applications. The one we're focusing mostly on today are video conferencing. These are visits between a patient and a provider. I too had one recently. I broke my wrist this winter and had to have some rehab done via telehealth. It was quite successful. Internet, we use the internet. We get all kinds of health information from the internet. Some of it's good, some of it not so good. Remote patient monitoring, lots of M-Health applications. For example, I get a text to remind me that I have an appointment with my physical therapist at the hospital for special surgery, which is very helpful to me because I tend to forget things more often than I'd like to admit. And then there is what we call store and forward technology. This is the transmission of health information or health records. So from a consumer point of view, which is what we're focusing on, what are some consumer telehealth applications? What can one do with telehealth? Well, certainly video visits with your provider, a general wellness visit, for example, a rehabilitation visit like the one I had, maybe a dermatology, or you've got some urgent care condition, you have back pain, or you feel you have an infection. But one thing that's really important is you must always check with your provider to see what is right for your healthcare needs. Okay, is a video visit appropriate for your healthcare concern? You can also use online patient portals to schedule appointments with providers, review your test results, request prescription refills, or send an email to your provider. We have one at Cornell that I use all the time called Cornell Connect. You can, as I said earlier, get text reminders about appointments or preventative care. Your flu shot is due. You can use lots of apps now to track and upload health information. And you can also view a lot of interesting videos on health topics. Here's just some examples of some of the telehealth applications that are available. So what are some of the benefits of telehealth? Certainly it cuts down on travel to providers' offices and clinics. And this is very good for people who have mobility limitations, transportation limitations, it's inclement weather, or you really don't want to travel, take public transportation because of things like COVID-19. It expands the range of services to specialists who may be outside of your immediate area. Maybe you have a specialized health concern, and a telehealth visit will let you connect with a specialist you normally would not be able to. You can address health concerns from the comfort of your home. And of course, now the limited physical contact reduces exposure to COVID-19. So what are some of the challenges? Okay, we always have to look at both sides of the coin, right? Benefits and challenges. Well, there's floating perceptions still among, unfortunately, people sometimes who design telehealth systems that older people are technophobic and they can't learn to use technology. And I'm going to show you some data that clearly disputes those myths. Lack of knowledge about the availability of telehealth, attitudinal barriers. People aren't entirely comfortable using technology. There are concerns about privacy. And when you meet with your individual providers this afternoon, you'll see that privacy is managed very well at each of our partnering institutions. A big one for me is that many people don't still have access to technology or technical support. Okay? A limited availability of training and instructional support, and of course, usability issues. And this is something we really focus on in our Center on Aging. It's really technology that's being designed without the consideration of characteristics of older adults. Okay? The idea being that people who design technology many times are younger people, right? Think about who works for Google, or if you go into a Mac store, what do you call them, an Apple store? Everybody tends to be younger, and they have this idea that older people don't use technology or they're not interested in using it, which of course is untrue. And here's just to show you that we have looked at this issue for a lot of times, have published extensively on this. You know, our CREATE Center has been around since 1999. So we have lots of data on these issues. And what we have found is that older adults, and we're even talking about people over the age of 85 up to age 98, really perceive technology as valuable and are quite willing to use it. This is predicated, of course, on if they see the value in the technology. Okay, they're not going to learn to use a gadget for the sake of just learning to use a gadget. Also, if the technology is well designed and they're provided adequate instructional support. Okay. So here's, I'll just show you some data. I am an academic, so I can't get through a talk without a little data. This is just some data from our lab looking at how attitudes towards technology have changed over the years. And what we can see is those lines. One is about comfort with technology. The other one is people feel good about using technology. Both of those, the top line, I mean, the bottom line is people over the age of 85, but we can see in all age groups, attitudes towards technology have increased. We also know that the use of technology has increased dramatically in the older adult population. There still is a digital divide, and I'll get into that for a minute, but use of technology has increased. Smartphone use has increased, but there still is a digital divide. But when we look at this issue, we have to understand that there are individual differences. Our oldest old are different than our youngest old, and they tend to adopt technology less. Individuals with disabilities are less likely to own and use technology. And unfortunately, and this has become very apparent during the pandemic, is that less technology use and ownership is associated with lower income and lower education, general lower socioeconomic status. And we're doing some research right now with internet-based system in rural locations. And we're finding, as has been reported by others, that many people in rural locations often have less access to high-speed internet. And that's really important when we're thinking about telehealth and the deployment of telehealth. This is some recent data that was just published in the Journal of Internal Medicine, and it's a sample of a large number of people. You can see over 4,000 people talking, and it was looking at what are some barriers to video visits for older people. And some are related to the technology design. Okay, our hearing and our eyesight tends to fall off a bit with age. And many times technology is not designed to accommodate these changes. There are cognitive challenges because systems are complex. People say they don't own an internet connecting device, they don't have technology skills, and they don't know how to prepare for a video visit. Okay. Just to show you what that data looks like, this is in millions. This is from that same study. Right now, or when this was done, this was in 2018, 13 million people who were in this sample, of, this is a different sample, I'm sorry, it's the national prevalence, feel that they were unready to, and these are people over the age of 65, to participate in any telehealth visit. Okay. That's a large number of people, and these are the reasons. Here's about 2 million who said they did not have internet-enabled devices or did not know how to use them. And I think that's something that we can all do something about. Okay.
Doctor, can I ask you to wrap up?
That I'm right at the end.
Perfect.
Okay. So how do we maximize the benefits of a virtual visit? Find a comfortable and private place for the visit. Write down important questions and concerns before the visit. If your provider is asking you for information, have it readily available. Reduce your background noise and choose a location with good light. Always be ready to take notes. And as the senator indicated earlier, make sure your equipment is working before you log on. If you need technology help, I put together some sources of technology help. One is check with your provider. They often give help and have training available. There's the National Senior Planet Hotline. As Lorraine said, they have a technology coaching program. There's OATS, and then many senior centers offer technology classes. So I want to thank you for your time, and let me just skip ahead. So this is where we are, and this is how you can get a hold of us. Thank you very much.
Thank you very much. So we're going to keep this in a very controlled amount of time, so we won't get to all the questions, I think. The first one was actually to me. So what proposals are in the state budget to improve telehealth, and do you support them? So I did some homework, and the answers are, I support some and I'm not sure about some. And there's a bunch of them, and there's a bunch of freestanding bills. So rather than spend our time today with me talking at you, we'll write something up in our soon, one of the next day or two's, probably next week, updates that we send out to everyone. And it'll have a section about telehealth and where is it in the state legislature. Next question is exactly where the doctor finished. Where can you safely store the vital medical records for quick and easy access by our doctors or our hospitals? Is there some kind of universal standard that can be used so that everybody gets to share everybody's information?
Well, if I understand this question correctly, one is about operability across the systems. That is an issue. Different hospitals have different electronic health record systems. I know at Weill Cornell, we use Epic. There are other hospitals who use different systems. So this question of interoperability has still not been resolved. People have different systems, they're used differently. So that is an issue.
Although it is true that when you're talking about telehealth, if you're working with a hospital or a doctor's office that has some kind of computerized records, you mentioned your system.
Right.
I know I actually happen to be a patient at NYU, so I'm on their system.
Right.
You have all your records right there.
Yes.
Go in, whether you go in to see someone, whether you're on telehealth, or whether you had an emergency and ended up in the ER, all of your reports, all of your test results, all of your prescriptions are right there in the system, which I find amazingly valuable because let's face it, if you do end up in the ER in an emergency, are you really going to remember your prescriptions off the top of your head? No. Are you going to know the test results for the last 3 years? No. So I do think that technology is offering us so many ways to make sure that the information healthcare providers need is available at the right time.
Yes, I still have some. I moved here recently from Miami, and I still have some doctors in Miami, and the information from Cornell is transferred to Miami quite easily.
See? Okay, so how do we assist older friends in accessing information from their medical charts when they don't know how to use their computers? Are we allowed to be their proxy in some way? Are we allowed to get access? I mean, HIPAA is very important and we want confidentiality, but can our friends play a role in helping us?
I think the way the friends can play a role is in instruction in terms of how to access it yourself. I think that's the role that someone can play. There's a lot of back and forth, and I don't know if this has been resolved yet, about caregivers, for example, being able to view the medical records of their care recipients. So I know there are HIPAA laws and HIPAA compliance, but I think, and I listed a number of sources of how you can get technology help. And I think, there are lots of ways that one can learn to use technology. And if the training is well designed, like as the training at DeRoad is, you'll find that it's actually quite easy to interact with these systems. It's just sometimes you have fear and you need to get over the initial hump.
Are there any big technology changes you see happening in the next year or two vis-a-vis telehealth and keeping track of our medical records?
Well, I don't have a crystal ball, but I certainly know that there's a lot going on in terms of robotics, and development of robotic systems, also artificial intelligence, virtual reality application, and virtual reality immersion applications. We're starting to do a little bit of work in that space right now. So that's what I see. A lot going on in sensing and monitoring technologies.
But you're not really suggesting a computer-driven robot's going to show up at my house to do the surgery on me, right?
No, we are firm believers that technology is augmentation, should support the human, but is not a replacement for the human.
Okay, because that is also one of the concerns you hear from people, that will we all just be, you know, faces on screens with no actual one-to-one contact with the doctor, and isn't a decent amount of evaluation and diagnosis based on seeing the person, and how is that going to be adjusted for in a world of telemedicine?
I think in the future, what we're going to be looking at is a mixed model of healthcare. That some of your visits will clearly be in person. I don't think that those are going to go away. Obviously, it'll vary on what the concern is, the healthcare issue is, and they could be augmented by some virtual visits. For example, if you have some kind of condition, maybe you'll go to the doctor the first time for the diagnosis, get the program of care, and then there'll be some video check-ins, which will alleviate the need just to go into the doctor if you just have a routine check on how the condition is proceeding. So I think it'll be a mixed model.
And is there a reason? I mean, you talked about the research showing seniors can certainly learn how to use the computers and jump into a world of technology and telehealth. But is there a reason that older people should maybe be a little more hesitant about not having one-to-one visits with their doctors?
No, I don't perceive that. I don't think so. But I do think that there has to be a mix.
Okay.
I mean, one of my big concerns is, of course, our issues of access. And I think that's really important. If we're going to move to using more telehealth and more telehealth applications, then I think it's important that people have meaningful access to telehealth systems.
Thank you. How do I improve my telehealth visits for geriatric patients? That almost sounds like a doctor asked you that.
Well, I think one thing is perhaps I put some tips there about how to prepare for a visit. I think it's important to share those tips with the person beforehand. Also, they may need a little guidance in terms of setting up their equipment or making sure they know how to operate their equipment. For some of the research that we do now, where we send tablets out to people, depending on the study that we're doing, we sometimes call them first to walk them through setting up the system. So that seems to work quite well. So it's kind of, you're right there with them, but you're not.
Right. So what is the research showing about using telehealth for mental health issues and therapy and psychotherapy versus physical illness?
I think that I don't have hard data right now, but I think it is being very, very successful. And I know my colleagues at the Westchester campus who I work with have been doing a lot of teletherapy during the pandemic. In fact, my one colleague said he has no more space for patients. And we're actually working now together to put a program on technology using laptops or tablets. It's a depression intervention that he's designed.
Well, that's certainly important because, I suspect, I don't think any of us have the research, but anecdotally, one of the realities of a year of COVID now, people locked in their homes without a lot of physical escape, so to speak, everything being just, out of normal, or
Yes.
whatever their normal was, that we're definitely seeing more mental health related issues springing up.
Yes.
I've been told in all generations it's impacting
Not
children,
right.
teenagers, parents, marital therapy issues, and older New Yorkers as well.
Yes, that is not an age issue.
No, it never was, and it was never, everybody can suffer from mental health issues at some point in their lives. And it's an odd thing to say, but it's perfectly normal to sometimes go through, mental health issues. And the important part is to know that there is all kinds of help out there.
Yes.
And so if telehealth is actually going to expand, access for people to get to specialists, I'm all for that.
No, and I think it absolutely does.
Great.
Yes.
So this is an example, the question I'm reading. When you have back and joint pain and it makes it hard for you to visit your doctors in person, even though you haven't even perhaps been diagnosed yet, can a televisit be used for diagnosis and prescriptions, etc.?
Yeah, I think, probably certainly for an initial visit. I will, of course, pass that to the providers when you get to that segment of the program. And then what happens from there will be dependent on the results of that initial visit and what your provider recommends for your further treatment.
All right. So we are almost at the 2:50 mark. I'm just checking to see if any questions came in through my computer. And if they did, staff, I don't see them. So I'm going to assume not, at least in the way that I thought I would be seeing new questions pop up, which is...
I see one. If you can do telehealth on a desktop as well as on your phone, yes, you can.
Oh,
as
great.
long as it has an internet connection.
Thank you. Thank you. Yeah, no, the phones really are computers at this point.
Yes.
Part of the challenge is how small a screen can you handle different assignments on? I suspect you'd prefer to be sitting in front of something that was at least iPad size to actually have a one-on-one conversation with a doctor. But if all you have is your telephone, yes, they work just the same. So
yes.
That's great. Thank you. All right. Well, I'm actually then going to thank you so much for your time and expertise today. I'm going to thank Lorraine for being our partner in all of this and in helping, and Dorot, and helping us really, I think, just continue the education we all will need to learn about the opportunities in telehealth. I'm not telling anyone that's how you have to do medicine. And if you don't want to do telemedicine and you want to go and see your doctor and make appointments and go to places, fine. But I think more and more we will realize that there are opportunities and improved access, even post-COVID, with telehealth. And again, I am a huge fan of the computerized records and data because it is just such a relief for me in dealing with my family members or myself in knowing that nobody's going to expect I remember everything that happened to me or what year or what was done about it or even what my prescriptions might have been in the past. I'm a busy woman with a lousy memory. So those are bad things to expect me to remember, particularly if I'm talking to a doctor at a moment where I'm not feeling well. So the fact that a computer can track all of that, including the test results and all the procedures I've gone through, I just think is amazingly valuable for making sure I get the right health care, including that because of my failure to remember to tell somebody something, something bad might happen to me because I forgot to mention, that I'm allergic to X. And then they give me X, and that's not good. But if it's in there in that computer system attached to my chart, then I'm less likely to be part of any kind of medical errors, because we also always want to be working on decreasing medical errors and improving the quality of the healthcare people get.